Our students are in the learning lab, learning skills from the fall semester of their sophomore year. They take a nursing class in the spring semester of their freshman year, and by fall semester of their sophomore year, they are in the lab, they are learning the skills. After half a semester of that, they are out in the community in healthcare settings, putting those skills to use, honing those skills, learning the fine art of developing working relationships with their patients, with other people, other healthcare providers. So that opportunity to do things that nurses do is right there and available to them from their sophomore year all the way through their senior year. Very rich in experiences along those ways. I think that some of our clinical hours that students are doing are some of the highest in this area. And with the recent release of the National Council of State Boards of Nursing's landmark study on the use of simulation as an adjunct to skill acquisition for nursing students and showing some very good outcomes along those lines, we are right in there with providing simulation opportunities for our students in the learning lab that are unique and interesting and fun. Learning needs to be fun, and our students are having a lot of fun learning different skills, both with the straight hands-on patient care and through our simulation activities as well. So they're right in there learning practically from day one. Our traditional students, as you know, are no longer the traditional student of yesterday that was right out of high school. Some of the students in our pre-licensure four-year program are single mothers, fathers changing careers, and students who are coming to college right out of high school. That's a nice opportunity for them to interact with one another. So beginning a nursing career is a very rich experience here at Malone University. Nurses who have associate degrees or diplomas perhaps have been working for a while and are ready to take that next step and advance their practice and advance their learning. Our program, our RN to BSN program, is very convenient. It's one night a week. We actually have recently transitioned that to a hybrid program, so one night a week or an online course and a little bit of both, and very convenient and relevant to a nurse's practice where he or she is, meaning we know you've got some experience, you've got time under your belt, you're a very good nurse and you're ready to take your practice to the next level. We want to meet you where you are and help you advance into those management positions, those leadership positions. For nurses who have a bachelor's degree and are ready to think about advanced practice nursing, our master's program is top of the line, and again, very convenient for working nurses, people with families. It is a rigorous program, there's no doubt about that, but it's manageable and it leads to the eligibility to sit for certification as advanced practice nurse in a much needed area of the country, with family practice and outpatient care growing by leaps and bounds. As you said, with the changing landscape of healthcare, our graduates are ready to step into roles. Oftentimes they're offered positions again before they graduate and find that the education and practice opportunities that they've had within their program really transition very well into the advanced practice role setting within family practice and outpatient clinics, pretty much anywhere they want to go. Probably the most enjoyable aspect of my job is to see a student come in, decided on a pathway, excited about that pathway, but unsure about the journey through there, and watch them blossom into someone who's confident and poised and compassionate and ready to take on the world and all it has to offer. And then to have that student come back at some point in time or send an email or a phone call and say, I'm really loving what I do, and I felt like Malone put me in a great place to step into my role with confidence and be successful.